So let's talk a little bit about the risk of people with hemophilia. So they can have lots of different types of bleeding. You sort of alluded to this about spontaneous bleeding. They can have bleeding in the muscle and joints. And so can you talk a little bit about that?
Yeah, so the obvious thing that comes to people's mind with hemophilia is someone gets an injury and it starts bleeding and it doesn't stop. But the big risk is usually also with the spontaneous bleeds because they can have bleeds into their joint or muscles,
Yeah.
and over time you have long-term damage and chronic pain
Yeah.
from these bleeds. You also have the risk of more serious spontaneous bleeds like intracranial bleeding or bleeding in some of the other vital organs. Another risk with these people is the emotional burden
Yeah, definitely.
of hemophilia. And me working with kids, I also see the change in family dynamics. And it's especially hard on our adolescent and young adult population. So that's a big risk. That's not really a physical risk,
Yeah.
but
Yeah, I mean, so obviously it affects the child, or when we're talking about children, but it affects their siblings,
yes.
changes everything in their family. So
Does someone have to stop working?
yes,
Do you
exactly.
send your child to daycare?
Yes.
Do you put them in soccer? And
Yeah. Do you disclose it at school? And when they start dating, do they want to mention it to their?
yes.
Yeah. So that's there's a lot of that quality of life and emotional toll for sure. So when we know that the bleeding and a lot of the new therapies are aimed at trying to at least eliminate spontaneous bleeding, but now try to eliminate all bleeding, which would be great for the future.